If you've tried having a baby for 1 or 2 years without any positive results, then it's time to get to the root cause of the infertility. In this video, I want to reduce anxiety about majority of the infertility investigations and walk you through what you should expect if you're doing them. So, infertility investigations are usually recommended by a specialist, a gynecologist. The gynecologist might refer the husband to go and see a urologist for further assessment, depending on the results of the test done. Now, let's start with male investigations. So, male investigations is majorly semen analysis and semen MCS. For semen analysis, what they're just trying to do is analyze the sperm. What is the shape? How fast does it move? What is the volume of the sperm? What is the sperm count? Remember that if the sperm has a weird shape or an abnormal shape, it will definitely affect fertility. We have semen microscopic culture and sensitivity. What they're just trying to do is find out if there's any STIs or infection and treat it accordingly. Now let's move on to female investigations. So now for female investigations, one of the major things they want to find out is hormone profile, the major hormones that are responsible for reproduction. Now, majority of them are produced by the pituitary gland in the brain. So you have follicle stimulating hormone, luteinizing hormone, thyroid stimulating hormone, progesterone, prolactin, and so many other hormones that will be tested for. Now, these hormones are responsible for ovulation up to fertilization. So it is important to test if they have adequate quantity in the woman's body. Now, this is another major investigation. It's called HSG. Now, why it is very important is that it will check for blockage in the fallopian tube. Remember that the fallopian tube is very important for the egg traveling down to the uterus and, of course, for the sperm going to meet the egg. So that is why they have to check if there is blockage. And, of course, they will treat accordingly depending on the results. We also have transvaginal ultrasound. Now, this is good because they can check all the reproductive organs and check for fibroids, check for the shape of the uterus, check if there's any abnormality that can actually affect fertility. You also have abdominal or pelvic ultrasound. Now, this can check for female inflammatory diseases. It can also check for fibroid and so many other abnormalities that can affect fertility. So this is really not like an uncomfortable procedure. The next one we have is high vaginal swab. Now it's just to check for infection and treat accordingly. Of all of these investigations, the one that is very uncomfortable has to be the HSG because of how the procedure is carried. Bear in mind that your goal at the end of the day is to get pregnant, and you just have to, manage the discomfort. At the end of the day, you want to be a happy mother or a happy father. If you've learned anything from this video, make sure you subscribe to our channel and share this video with someone else who needs it. Bye.